Imagine you have to undergo a medical procedure or a minor surgical procedure. For example, having a wart or a mole removed from your face. When you arrive for your appointment, you are told the person who is going to carry out the procedure is not a doctor, they're not a nurse, and they have had no previous medical training. They don't have a medical degree and they don't understand the risks that this procedure entails, let alone have the understanding to handle any complications if they were to arise. Would you be comfortable for this person to carry out this procedure? Hopefully not, but the truth is that thousands of people in the UK are allowing non-medical practitioners to carry out cosmetic procedures on their faces and bodies, sometimes with terrible consequences. Hi guys, my name is Dr Haroon. I am a cosmetic doctor who specialises in non-surgical aesthetic treatments. Unfortunately, in the UK, there is little to no regulation when it comes to the aesthetics industry. If you go to pretty much any other country in the world, you must be a registered medical professional to carry out these treatments. I won't talk about why the UK government has not regulated this to improve patient safety, because this is discussed in detail in another video. However, in today's video, we will be discussing some of the reasons why you should choose to see a medical practitioner if you are considering having aesthetic treatments, namely dermal fillers, Botox treatments, and skin boosters. Let's get into it. The number one reason you should choose to see a medical practitioner to carry out your aesthetic treatments is to minimize the chances of something bad happening. The rate of complication occurring from aesthetic treatments amongst doctors, dentists, and nurses and other medical practitioners is significantly lower when compared to non-medical practitioners. Medical practitioners would have spent at least 3 to 5 years at university for their degree. During this time, they would have learned about the human body and human anatomy. A detailed understanding of anatomy is what allows medical professionals to maximize their safety when carrying out aesthetic treatments. Another important point around safety is recognizing when something has gone wrong or a complication is unfolding. Doctors, dentists, and nurses are taught to recognize complications early and to deal with them accordingly. So even if something were to go wrong, a medical practitioner will be able to recognize this and treat it appropriately. The same cannot be said for non-medical practitioners. They simply don't have the years of experience seeing and treating medical complications. Many of the nightmare complications you see online are due to a non-medical practitioner not having the adequate training or experience to recognize and deal with a complication. The second reason is that you are more likely to get an objectively better aesthetic treatment result from a medical practitioner. This is a bold statement. However, having been in contact with hundreds of aesthetic practitioners and having treated thousands of aesthetic clients, I can say with some confidence that your treatment outcome is likely to be better when you see a medical professional. The main reason behind this is access to training and educational courses. As aesthetic practitioners, we must regularly go on courses to become better skilled injectors and therefore be able to deliver better results to our clients. The biggest and best training providers in the UK will only train medical professionals. They simply refuse to train non-medical professionals. So that begs the question, where do non-medical practitioners get their training? Usually from other non-medical practitioners. Would you believe it? A non-medical practitioner teaching another non-medical practitioner how to carry out medical aesthetic treatments. In aesthetics, training and education is the hallmark of effective results. The third reason you should see a medical practitioner for aesthetic treatments is because medical practitioners are more likely to focus on helping you and less likely to focus on making a quick buck. Again, another bold statement. However, there is some sound logic behind this. Medical professionals have been trained to prioritize their patients' needs first and focus on helping them. It's in our nature to do what we can to help the person in front of us. and this nature is transferred over when we carry out aesthetic treatments. Medical aesthetic practitioners are still running businesses and still need to generate profits if they're to stay in business. However, their primary driver is usually not money. It's the satisfaction they get when they've helped one of their clients improve their confidence and self-esteem. You're also less likely to find medical professionals being pushy or hard selling aesthetic treatments to you. Our medical governing bodies state that we are not allowed to hard sell any treatments that are cosmetic in nature. Non-medical professionals do not have a governing body that they have to answer to, so they can be as pushy as they'd like to be, which in my opinion is a bad trait of an aesthetic practitioner. These are a few reasons why you should see a medical professional over a non-medic when you're considering having non-surgical aesthetic treatments. You're more likely to achieve a desirable result in a safe and effective manner. I hope you found this video helpful, and if you have any questions regarding the treatments that we offer, please get into touch. Thanks guys, bye now.